Yat shikado shidne. Kodo ya di bini bi kodo. Hanen hichona dilne kod a kwije ya kon hitodizin. Be anil I do hidi date. J.D. Perfilia Fowler, Dashijanido, Division of Human Resource Director, A.I. Na nishi beshet idlin my deshkijin shlom todichini bashichin asche dashanal do trabai dashichi. Todas ahol yene ade is nasha. Ko kashe kodo tutadilzen dole. Kodo hojon dole shamana hassan yadeshil. Zehlistan twistan ano chalchil hayol kal. No de tu Jonah halchelti halchewan. Na dalke na dalsu tradedin ani. Sa ana rebik a hojon kodoni yaje ne ewe enandi ne koye hashil so da akwije kon. Te dilzi le shamana hassan ado di in the net no slini dan ade. Hashil so da kodo akwije kon. Joba ini zindo joba adine. Kon hashil so hon dene belchahozo bakado. Nihin na des ago hon hashil so. The kosten ta nast da bebet oje the kosto joba the kosto ini. Nihit handni kon adije adit kon nihit adult le hon. Hala ya kon na hasan bakat ne dado ni zintla. Nihin na da dos kasa nihin na da dozel. San nihin na da docha hot ya kon. Nihit joba ini zinle. Ado asa ani zino kon nihidene. Da istra ado hon beti ishliji kon. Hanada askizi asa ani zino kon. Nihit na kon tlodo le kon. Nihit ket adon le nihit sit aje. Hade shin yidal. Nihit maholo nihit je daholo. Ado kon nihit masane nihit nal. Daholo lat hadol jist ad lahon hil daholo. Ado naka alchine elage. Ket na rais ni na rani ho adon hit so ken ni nalle ketan le ni hiran na has ago kon ni konta del clean hit tasket na lago ni honesh kishna khagon hi konta del cleo ado kon hi kya na has ago altro bebe nashni dole ya at ego na da has adole shamana has lini kon di in the net da no lini dan ade Hashil to kon the neni cleaning kon at on here the ho at Nihina antin nazlaho ado at a kon the in the nebitchini and laho yat ekon ha insendole kon hit to the zen yin nihit will in kon quid kon hata the endole nasko neje ado kon has twisani and leaning kon benashni dole. Betrayada hot dole honstra in lini hode. Yad hon ye ina na yost dole kon bena antin a kat hanata has lagon ha insen dole shaman hasan. Ado kon chindan lini kont ahuichi edo na haba da hol yadole hon. Ashi ani hon betinga da det oden de jono kon tekes on ha insen dole ha chinen lini. Ado kwije kon hit a lot so benedin kwije kon na khadat en la hon yat ko hon nada kedole hon to lot so dan lini kon ton hit a la ba hon yado le to hon large na khadel nishi yat ko bet khata hostel na kha insen ton ich khata alni na kha insen ton ich bzilo in hinsen hon stra in lini hon Ado kon khandal de shikon de nebel khata hosto bakao yat kon na nishte naisi khidole khala in juno hon na nishlik nazla hon nihimat en hijet hon hidien hon yat bana hu yado yat na nishte naisi khidole hon shmana san leni hon ado hashin so kon hidne sani his tweets of kjk dan leni hon ezel iden as dan hon yat da den nicht kassen no hon ni das kedole hon aro altro hon ni den dan lini ko hashin so hon bechen da hoinan le hashin la ko wali at nas dan juno shon dan ni ji on cheda isni dole hon shmana san lini ko aro hashin la kon hidden dan lini ko Khaditin nahasada dan let khaditin that they sos zebe nahagahaj da hon aro konal sos da hon that they an lenjono hon betaya hot eto le hon alspo asa anazna but nahas an go hon shikati in lini hon alspo benashni do le hon nahasam khani dahi hon yat ehon hisad yat ehi belchi yana del kido be nansi zero aro hon nat ani dan leni alspo benashni do le besh bahasa anet khat naznile Tnejjibe dabet ochi alsko oshi yugo hon bento tozilzina la nanda hon an sheho e hon inanishtla do le hon tozilzini hon shando la do le hon nasgo net nijibe inanit edo le konat ani lini alsko nakhabel da hon lo do le kon tilate nat ani sila ado hon shiyash be ina hon yat e hon nanat ito le hon hitine abah ado hashin tsugo hon tilate nat ani betan hito chin hidon hit khayata hot etole ani tsohona nishin lini biche khana ini ni dole bichin hit sketo bichin hit zilo en hinsen hot a eto bezin lini kombe hanana si dole ati de ben hit hojona hasli yeah. At this time we'll go ahead and give it to our president, Mr. President Jonathan Ness. Yeah.
Dr. Fowler, Kudotzin, Nabahinzi do Ben Hitzil, Dich, Anils kon Hitzin, Nikeda Hallo, Lashedo, Askedas, Ed and to even Nache, DG, Qua Hitzil do Benastini Kashkedoshina, the Jonathan Nez. Anhilne a Shane slaughter Nessani, but she's to the chini, the Shichiro Trachini, the Chanel. Yad then he did needle left Nana di Jenna Kijinda and the Shana. Kodo Shadeja, Dr. Fowler, Nija had Z ya Hota Hanet Hija Kundeli, Nakijinda and the Shana, Dinginda and the Shana. Akui Gia. Ahot na nish do koje di naslnigi do kosenskagi nast eitzata banda huilne do nichido ade da isnofsagi here. Good morning everybody. This is Jonathan Nez, Navajo Nation president, and as we do every Tuesdays and Thursdays, we have an update on the public health emergency pertaining to COVID-19. And I appreciate you all tuning in and getting the information that you all have been sharing with the rest of the Navajo people, your relatives. We have viewers from Rama, Navajo, and even as far away as Germany, Houston, and Phoenix, and of course here in and around the Navajo Nation. Good morning to each and every one of you. I know sometimes these town hall meetings take a lot of time. There's just so much information that we like to share with you, and you know it takes time, especially when you do translate it into the Navajo language. And then in the Navajo language, it takes a little longer to explain or do updates. So just bear with us. As you know, I tend to switch hit from English and Navajo. Navajo is my first language, and those of you that have Navajo as your first language, you know that is the reason why at times there's some pause. We have to think about it and in our minds, and also translate it in a way from Navajo into English. So please bear with us today. The new numbers as of yesterday evening, ladies and gentlemen, 85,772 of our Navajo citizens have been tested. And that's more than any other state in the country at above 40% of our total population being tested. We have been testing aggressively here on the Navajo Nation. And, because of testing, of course, you'll find negative and positive cases. But here we have 71,972 people that have tested negative for COVID-19. I know our focus has been on those that have been tested positive, and 9,315 have tested positive as of yesterday, 5 p.m. Now, from Sunday to Monday yesterday, and this is the report I received that I'm sharing with you from yesterday's epidemiology report, we only have had 7 positive cases in 24 hours. And I want to applaud the Navajo people for your diligence, for your work, your advocacy. I know that I have said many times, Vice President Myron have said many times that government can't do everything. And it's up to the Navajo citizens, the Navajo people, to share this information with our relatives and our friends and our people throughout the Navajo Nation. And you have done just that. But it's not time to let down. We got to continue to do the awesome work that you have been doing for these couple of months. That is wearing your masks in public, also social distancing, and washing your hands with soap and water, using hand sanitizers, and staying home. Our shelter in place order, our stay at home order is still in place. And so we shouldn't be seeing people driving around just for recreation. It should be for essential services, meaning going to the clinic, going to the hospital, going to the store. And we also ask that you do it one at a time, not as a family. You have essential warriors, essential runners in your family, and those elders that are by themselves at home. That's where citizens should be stepping in and stepping up to help our elders, and really limiting the contact. And the positive test here shows that from one day to another, to yesterday, only 7 positive cases. Thank you so much. Overall, the recovery number, 6,878 have recovered from COVID-19. From Sunday to Monday again, we only had one death, one way too many. And our hearts and prayers go out to the 473 families who have lost loved ones here on the Navajo Nation. Let's continue to hold them up in prayer. Arodi kodo naltsosin chichi koda liagi ya kodo ngalchen ik edan linigi del kagi ya ya nahast adin doba ashla demiliaj doba sus nezatin doba sus din doba anaki enelt au ikoni ikeni na daska tesda badilia aro di kosentsagi di nasnegi bedatolnagi nast demiliaj do tra nezatin do ashla tsata hota di ikoni ikeni na bedatolna le alsa ya ifni da ya do di jinje jo enelt kodoba hoshna nast de meliage doba ako adainos ne do kon hanen hije kondeli ni chito ni ze bikidas tiao kon kada to ka ado anolsko keno senigi hagan has ade keda hot inigi ado lego chanda khaya doi alsko ke nalia ba gan go de khida do nen ashkhon alla de bichata yanigi nakha daishni tollel ado zel en gonda ahot asa kunda khna khabiga ado kon ni na mado je naslenigi che masan nal naslenigi ya nakhalchen don yetso kebchata ashkhod je ehot ni na antin nakhalchen ni masan ni che ni nal ni tso kedo edo bichata ne masan bikeda i ado bada hoshia dabdo ne doyo le aha de shikeda hat dado ne ado de ina de ado dado ne ebeni nasa ni masan ni che ni nala asahan da hasta kodona khalchni yetsoken nalike bicha ya deiltio ebeni na don khanda khata ahot abich deil ajokat ashta dosne hatne excuse me ina antinkat benta hadil as chukade aja hojish le kishta deil khego pa ashta dohne tani dohni amado je masan nanala naslani pa kon galshan dota biyada ho atayanda ko le nation da ilniya kana tinda del khalanda ado the mo yajigon da ashta da dohne da dohno jogata ya yansda kirstole ado na kitchen try di da annashonada le na liaba wand chian to ha ishi dan nosenigi in da ilnitole jogata ya ashta they need zindole shigero shidna ado hasta de mil yaj so nezna tindo ba sebeti to sebi enelt ekon mikeni hina ayat endasling to yichdas kredit kosinskagi na states atta aro din nezna tindo ba so tindo ba tranelt ekon hikeni hina ta yitsa da jitten shin ekon hikeni na ba to deal zindole hoich fliot an hina mitindole shigero shidna ba to deal zin khodo adishnita yitso zindahala jo kon ya dien nakha na yidla to na yizla ditso zingi gi anda na cheikon de kosinskagi ya kon nilte ne beke apka dien bogad ba da huitni ho di nakon so that's what that does. You know, we also have updated our curfew hours. Now, each day, our curfews, our lockdowns are for 8 hours, from 9 p.m. to 5 a.m. each day. And again, let's not let down. Let's continue to follow through on these public health orders. It's for our safety, and you have seen the results of your hard work in staying home because these numbers are decreasing here on the Navajo Nation. As I mentioned, only 7 positive cases from Sunday to Monday, and you all are doing a good job. Let's continue. And that's the message I want to reiterate here to our citizens. Let's continue to keep those numbers down, and we can gradually begin to reopen our tribal parks. Many of you want to go out and get some recreation time, go to the lakes, do some hiking, go fishing. We are looking at opening up these tribal parks here on the Navajo Nation to our Navajo citizens. Let me underline that. Have you underline that? To our Navajo citizens first. We will continue to not allow visitors onto the Navajo Nation until we see a bigger decrease in cases, positive cases all around us. Phoenix, Arizona has begun to start to flatten out on their cases, and we thank God for that. And other states like Utah and New Mexico, Colorado, and Nevada have started to see a decline in cases. The weekend curfew, as you all know, has changed from 57 hours to 32 hours. So rather than Friday, now it's Saturday at 9 p.m. So Saturday, 9 p.m. to 5 a.m. will be the 32-hour lockdown curfew. Because, Grandma and Grandpa has told us to get prepared for the winter. And that's what we're trying to do here, is that many of you need to get the harvests from your farms, get them ready, get the food ready, get them packaged so we can put them in the freezer or the storage to get ready for the winter. Also wood hauling and a lot of other things that need to be done at home. And we need that time Saturday. And so get prepared. Don't just think that's another free day. Really prepare for the winter, because experts have been saying that during the winter, we may have a bigger spike in COVID cases. But let's all work together and prove them wrong. I hate to say that, but we have shown the people out there that if we follow public health recommendations, we can slow down the spread of COVID-19 here on the Navajo Nation. People are looking at us, and Navajo Nation is wondering, a couple of months ago, they saw the high spikes in cases, and they're like, wow, man, Navajo's getting hit hard. And then within a month and a half later, we saw the flattening and the decrease in cases. And now, ladies and gentlemen, we just had recently 7 cases in 24 hours, where it used to be over 100. And that's because of each and every one of you for honoring and respecting leadership and healthcare professionals out there. So let's continue to do that. Let's get ready for winter. And I mentioned last week that we're going to be doing the 11th annual Running for a Stronger, Healthier Navajo Nation. And I want for you all to know that, we're going to be doing it virtually this year. Running for a strong 11th annual Running for a Stronger, Healthier Navajo Nation. We're going to do biking, running, walking, even horseback riding, even getting wood is exercise. Working around the house and farming is exercise. So from September 7th, we're going to start the Running for a Stronger, Healthier Navajo Nation virtual run all the way to November 15th. It's going to be 10 weeks. We're going to do a virtual plan. There's going to be There's going to be many activities. There's going to be some incentives, some items, backpacks, water bottles, and other things, jackets, shirts, those types of incentives. for 10 weeks. We're going to also provide you a running or walking plan, a 10-week plan. Those of you that have never exercised for some time now and want to get back into shape, we'll have a 5K running plan, walking plan. If you haven't walked or run in some time and you want to run and walk, make it a goal to run or walk 3 plus 3.1 miles, there'll be a plan for that. You know, each day you track your goal, your walks, and if you follow that plan, I guarantee you by the end of 5 weeks, you will be at 3 miles. Those of you that want to challenge yourself to 10 miles, 10.2, 6.2, 10K, we'll have that plan as well. We'll also have a half marathon. Those of you that really want to challenge yourself, by the end of this 10 weeks, and if you follow this program with the help of your physician, I promise you, if you follow this plan, you will, by the 10th week, be able to run 13.1 miles. And that's an incentive. And you're probably wondering, what does that got to do with COVID-19? We're preparing ourselves for the winter. We're getting our bodies healthier. We're strengthening our immune system and getting our bodies ready for a possible second wave. There's no cure, there's no vaccine for COVID-19 right now. So the only way to combat COVID or any viruses is to strengthen your immune system. And that's by eating right, eating healthier foods, and also exercising. And the other thing that we're going to be doing, those of you that have gardens out there that are willing to sell your produce, so on Thursday, listen in. We'll get you some information on Thursday. The Navajo Nation would like to purchase your fruits and vegetables that you have grown. And we're going to be giving them out to our Navajo people, those that are most vulnerable population. And if you don't want fresh fruits or vegetables, don't come to our food distributions because it's going to be mostly vegetables and fruits. But this is one way to help our farmers through this trying times with some dollars. We get the fruits and vegetables, just like we did last year with, banning candy at our parade. Remember, at the Winter Rock, the Navajo Nation parade. Rather than spending thousands of dollars on candy last year, to hand out at the parades, what we did last year was we spent that same thousands of dollars and we purchased fresh fruits and vegetables, and then we handed them out at the parade. And it was a great success. We still hear a lot of positive reviews from that, and we want to do it this year, and we want to hand it out to our people to spread the harvests, the items to a lot of our Navajo people throughout the Navajo Nation. I mean, what better way to strengthen your economy, help farmers, and also help get healthier foods to our Navajo people? So that's going to be the running for a stronger, healthier Navajo Nation. 10 weeks, September 7th through November 15th. We are in the process of getting, I'm hoping by the end of the week, we'll have the flyers out. Those of you that have been in part of previous running for a healthier, stronger Navajo Nation will probably receive a postcard letting you know that this is coming up for this year, the 11th annual Running for a Stronger, Healthier Navajo Nation. Let's get prepared. Let's get our bodies strong and then get it ready for the winter. Public health experts have said that having the flu and having COVID-19 together is a deadly combination. And we don't want anyone to get the flu. But my assumption is this, ladies and gentlemen, this is just my personal assumption that, I think the flu season will be a lot less this year because everybody's going to be wearing masks, right? We're going to all be wearing masks. Every single one of us will be wearing masks. And if we do that, there'll be less influenza. There will be less COVID-19. And let's make that a goal for the Navajo Nation. So I challenge you, Navajo Nation. Every good leader puts a challenge on their people. I challenge you to continue to wear a mask, to social distance, and to wash your hands with soap and water, and to stay at home. And the next thing that we want to talk about, oh, by the way, we were in Winslow Indian Healthcare Center Service Unit area this past weekend. And we'll put up a PowerPoint shortly, but we were concerned about that area having a above average amount of COVID positive cases. So we went to, on Saturday, we went to Delcon, we went to Winslow, we went to Loop during the weekend, and we handed out food items. So, but mostly it was, we wanted to get the information out. So those of you that got food out there, and probably not everybody did, we recognize that. So don't start saying, what about those people out there that don't have rides? We left boxes with our CHRs there, so they'll be getting those food boxes to those that don't have vehicles and that don't have reliable transportation. And most importantly, those that are in that vulnerable population category. So we're hoping that the information, the packet, people will read and to be aware. And like I said, ladies and gentlemen, last week, we have contact tracers now. Those are investigators, if you want to call it private eye. I think that's what they used to call it back in the day. But these are individuals who investigate where the virus came from and where it's going or how it's spreading. And so contact tracing is, again, a key to slowing down the spread of COVID-19 here on the Navajo Nation. It keeps us and our families and our communities safe. And we want to say thank you to Dr. Jill Jim and the Health Command Operations Center, the Epidemiology Department, Ramona at Epi and Dell and many others, and many of the healthcare facilities that have been really putting an emphasis. And right now the need is 150 contact tracers throughout the Navajo Nation. So listen out for that. There'll be some job opportunities and to being an investigator for the Navajo Nation, because like I said, there's no vaccine or cure right now. So we're going to have to rely on contact tracers to isolate new cases. But you know what? Contact tracers are finding out that people are traveling and people are going to hot spots, even though we advise. I'm not saying that the majority of the Navajo people are, but some are. And those of you that are not listening, we're calling you all out on it, because contact tracers are finding out that you travel to Phoenix, you travel to other places that are hot spots, and you potentially are spreading it within your household. And contact tracers isolate those families so it doesn't spread even more. And that's why the numbers are a lot less. Our goal is 0, but it's not going to happen because there's no vaccine, and people still need to get out and get their essentials. And because of that, there's no way to get to 0. Even though people say do a full lockdown, that's just not doable, because many of us rely on food and supplies to be purchased in our shopping centers here on the Navajo Nation. Or you have to go to the hospital. We have to go get gas. We have to go get water. And so those of you that are saying full lockdown, I think it's time for you to really just chill, right? And to just take on these public health requirements and do it for yourself and for your family, and don't worry about other people. Worry about yourself, your family. And if you do that, and if you focus on that, there won't be a big spread of COVID in your communities or here on the Navajo Nation. So take on these public health recommendations and keep your family and yourself safe on the Navajo Nation. This Saturday, we will be, I've been telling you that we are getting donations from many people. And Phoenix Indian Center did an outreach for the Navajo Nation a couple months ago. A lot of people in the Phoenix area, our own Navajo citizens, donated because they couldn't bring their food back. So they donated to the food drive in Phoenix at the Phoenix Indian Center. And I want to say thank you to everyone in the Phoenix metropolitan area that donated food and supplies to the Navajo Nation during our peak coronavirus outbreak. And so we can't just take and take, right? We are a nation as well. And being a nation also means that we should be giving back to those that helped us. And so this Saturday, we are going to be facilitating a food distribution at the Phoenix Indian Center. So those of you that are in the Phoenix area, the address is 4520 North Central Avenue, Phoenix, Arizona. Again, 4520 North Central Avenue, Phoenix Indian Center parking lot. And so we received many donations. Those of you that want to donate, donate at your local Bashas supermarket. If you're in the Window Rock area, bring the items to the office of the president and vice president, the executive offices, and many organizations here on the Navajo Nation are donating. The churches are donating, World Vision donating, and many others. And we're going to be facilitating that food distribution for those that are in need there in Phoenix, Arizona. As you know, Congress did not extend the benefits, unemployment, and the aid and the resources that are needed for people throughout the country. And so people are going to be struggling. And Navajo people, it is our turn now to give back to those that help us during our tough times. And that's what we're going to be doing this Saturday in Phoenix, Arizona. Those of you that are in the Phoenix metropolitan area that want to donate, please contact the Phoenix Indian Center if you like to drop off some non-perishable food items. It's hot down there, so we don't encourage fresh fruits unless you bring the fresh fruits the day of the distribution. And that's going to start at 8 a.m. Arizona time, 9 a.m. Navajo Nation time. We do have volunteers there already. And so it's going to be a non-contact food distribution. That means we're going to be all in full PPEs, and those volunteers will be down. Leadership will not be going down to Phoenix, but we will be facilitating that food distribution drive just to let the people know that we appreciate their donation during our tough time with COVID-19. We're giving back during your tough time right now. And hopefully, we are able to help out for many days for you and your family. And we'll be here on the Navajo Nation, but our prayers and our thoughts will be with you all on Saturday. We will have the Phoenix Indian Center staff and other volunteers there giving out food, and we'll be facilitating and taking some of our donations down to the Phoenix area on Friday. And this food distribution again is at the Phoenix Indian Center on Saturday, 8 a.m. Arizona time, 4520 North, something. Let me, sorry, I did memorize it, but it's 4520 North Central Avenue, Phoenix, Arizona. That's the Phoenix Indian Center parking lot. So come and get some supplies, some food if you need it. If you don't need it, then, if you want to donate, you can donate as well to them. So the more yajaguna ya kodo ni keni hidna ni kai jegia kodoshi ya kai je dole shikeroshina. So eshi kodo bedash ni dole to ni keni hidna ar keda hatinigido Ashton daslet dole Arnold kodo shikeroshina. Sagi. So, yeah. Kodoshi ada nihikeni hinekedat nigi nihikai jeya nihike kodochi yando dida betlinda nigi nihike kodayila. The Atlant resident jo kode yego de deskidia le meyata ko ad khalchen yikedan lengi akai je tian hiche kodayila jo indasi ni yani bedas Atlant resident no anesna chapters in daznela ya hota hinan shidelia. So nihido kodo adadi neya ola Chiyan da oni pelagana da oni hikeni yikai je nihido ka di chata di no ye beyelti ebni na ekon chiyan da hitla ekon hosdogo biche koda dilni di the more yajigona Saturday gonna tepi ol kilo obin go Phoenix Indian Center. A parking lot gonna to the Dazana gonna ishi nachikode leho kwashi ya chian de ni dole chikedo shina. So shido akadesh watano senigia lay bashes and dazna lona edo ade dabadona a dean lay Phoenix go chian be akadesh wat I dashi it's ade boxa ishi kona Chian the Kodado Shishi, a con which a Kodadil Nishti Nakikeni, and Hishi Kodo not any clinicin shade or conde credante, but Sadils and Shido less add Dal Neshigi, Phoenix Indian Center do a car not jaggy. Asian a day let or less, Chian de Nito less, or only any Hide Chian Hitch a Kodal net or less. So, but not a kota a yashan hikeni and I did unzania. Shit. Chakon lay internet be in the Alkodan. Nikia the Gian Hichakodaliad. Nihisha da noda yadat. Nihide ada dates in Allen. A conda Nihie. How she Nihido ka deal with order. Chukadai aja holjish. Nikelpedas and lejos to the yego de desk. The quishi the more zli the COVID-19 di the kosentragi yego de kon nihinde even in nihido kodo kadicha shikedo shibna. Kadicha. Khalchindo the keda hat ni kedo ni keda hat Ashido Kadicha Chikedo Shina Paradise and Sangi. In conclusion, I want to let you know that the legislation from the council for the CARES Act in the amount of $650 million came to the president and vice president's office. And we are now looking through those documents because there was a lot of amendments. You know, we recommended a package, right? We recommended relief to those that are struggling out there, families that are struggling, college students that are struggling, elders, propane, you know, those types of relief we recommended. Guess what? None of those were incorporated with the approval of the legislation that came through the council. Housing projects were put in there. I appreciate that by the council. Water projects in the amount of $130 million. That's something that we've supported and that we recommended as well. Power line projects, $44 million is what the council appropriated. We wanted a little bit more, but you know, these are projects that need to be completed by December 30th. Broadband telecommunication projects was approved by the council, $68 million. Solar projects, $69 million, but these are going to be other organizations doing it for the Navajo people. And hopefully they have maintenance that also is included. Solid waste, $23 million. So solid waste was approved by the council. And listen to this, ladies and gentlemen. They approved hardship assistance. Okay, hardship assistance. Guess how much? $1,000. $1,000 hardship assistance. That's going to go to only one person, maybe, or two people. I don't know. Parks and Recreation Economic Assistance, $828,000. That's for the Parks and Recs. Vendors, I think, and artisans. See, these are the items that were approved by the council. So we're still looking through these to see what those amendments are and what it's for. Some of these were not our recommendations, right? Because council's the one who, you know, legislates. We presented our package. We thought it was a comprehensive package, but you know, the end result is a lot different. Navajo Gaming, we supported $24.6 million. Payroll support, I don't know what that's all about. You can't go back in time and start paying people and reimbursing them from the general fund in the amount of $90.9 million. Housing projects, $33 million. And you know, we have a a small manufacturing facility that was started. And so we'll see what that proposal entails. See, some of these proposals that we gave to the council, they took those proposals, but they changed it around inside these proposals. And so we have to evaluate those. Judicial branch, $9.6 million. We supported that. Chief Justice, that's her recommendation. The controller, I don't know what that's all about for $20 million. Madam Controller, I guess, wants some money for something. We'll look into that in the amount of $20 million. Economic development, $60 million. That's for our small businesses, our businesses out there that are in need. Sounds to me like that might be the same package that we recommended, at $60 million even, but again, we'll evaluate that. The public health and healthcare, $75 million. And that's for, you know, once the vaccine is available, how are we going to get the vaccines out? Do we need to purchase more flu shots? And so that people who want a flu shot can get it during the winter. So that's the package that was approved by the council. And it's going to take some time to vet that. But what I don't see here is that there is no direct relief for hardship assistance other than this $1,000 to our Navajo people. Our Navajo people are struggling. Our elders are struggling. Our college students are. I recommended $50 million to our college students, and that wasn't even considered here. We recommended some resources to our elderly as well to get them prepared for the winter, including propane. That wasn't considered as well. So, ladies and gentlemen, I just want you to know, I know we got to get this done, but we got to get it done correctly. And we also have to give relief and aid to those. I've heard stories. You're behind on your rent. You're behind on your electricity payment, your car payment. Many things. You don't have enough money for groceries. Now that the federal government can't even pass a relief package to help our U.S. citizens, we have to look at ways to help our Navajo people that are struggling. And so we may have to line item veto some of these so that we can put some money aside to get to those that are struggling out there. And we need to put some money aside for those individuals. Not everybody's struggling. Some people were on administrative leave. Those of you that were on administrative leave, that were getting paid during this time, I respectfully request that you should be okay. I'm talking about those that lost their jobs, that are staying home, the folks the iron workers and the carpenters that didn't want to leave their family and put their family in danger by working somewhere else, possibly getting the virus and bringing it back. They made a sacrifice and said, I'm going to stay home, take care of my family. But that sacrifice means that they're not bringing in income. Those are families that are struggling. Those are families that are getting behind on their bills right now. And our college students right now, they're going to be in need of some support as well. And we need to make sure that our people are going to be being helped throughout this time, from now till getting prepared for the winter. And that means getting supplies stocked up for the winter. Who knows how hard we're going to have during the winter. And so, but of course, infrastructure is important. We need to get electricity. We need to get broadband telecommunication because our students are staying home. We need to get water lines to our people, propane, heating for those that are in need of propane during the winter. Get everybody prepared to hunker down. And see, now we can move around because, it's not muddy or there's no snow. And so we can get what we need. But when winter comes, snow, mud, and harsh weather comes, then it's going to be difficult for us. And so we need to prepare. And that's what we need to do from now till the first snowfall. So we're going to be vetting that this week, and we'll keep you, we'll do a side-by-side comparison come Thursday for our town hall meeting. Thursday's town hall meeting will be in the evening at 6 p.m. Some of you viewers said, let's keep the Tuesday at 10 a.m. and the Thursday, let's move that to 6 p.m. So stay tuned to Thursday. We'll give you a side-by-side. By then, we'll know what all these amendments were done on the council floor that were presented to us and what we're going to be doing as our next step. But we need to get direct aid to our people. So those of you that are commenting to hurry out, maybe you should be helping us prepare for the winter and get out there and help your grandma and your grandpas and your nullies instead of staying inside in your little cave and punching away on keyboards. Let's be a solution. Let's get out there and help each other out during this public health emergency. And the only time we hear you is during the town hall debates on your comments. And other than that, we never see you or hear about you at these food distributions. If you really want to do an impact, and if you really want your comment to be heard, then volunteer your time to help our people. Tomorrow we're going to have a roadblock, a checkpoint. We're going to be giving out information, especially in the Fort Defiance area, Gallivandia Medical Center Service Unit area, because the cases here are still up high, above average. And we need to get everybody information. There's new information out there that are in these pamphlets that we're going to be sharing with you. And so we are going to be doing some roadblocks here on the Navajo Nation to get you information. So don't complain, just pray. That is the motto that we have been saying from the start of this pandemic. And if you can make a difference, and if you're an able-bodied citizen, then volunteer your time. Don't just complain. Don't just complain and think that you're doing something positive by blasting leadership or blasting people around you. Take it upon yourself to help somebody in your local area, your elderly that's close by, your veteran that's in need of help. Maybe even tell people that they should stay home and hold each other accountable. Now, use that negativity in a positive way. If you're truly compassionate for your people, and if you're in it for yourselves, then it's best to just keep quiet and just mind your own business and take care of your own self and take care of your own family. But overall, I think with the changes that need to be done here on the Navajo Nation, we need to take on the responsibility as an adult and act like an adult. And, many of our elders fought hard to bring that teaching to us, went through some tough times as a nation, as a people, to get us to where we're at today. And they put some tough love onto one another so that we can be the most influential and strong nation that we are today. And so keep that in mind as we are dealing with this pandemic. And some of you, I see you on some church virtual meetings, and it's quite interesting that the same comments of negativity are the same people that are listening to church service. So we need to be, Christ-like, right? And to support each other. And that's just not Christianity. That's all relations, And it shows that you haven't grown up with that teaching by the stuff that you put on social media that reflects you and your family and your lineage. So those of you that are saying this negativity, that use your real name, we know who you are and we know how you've been raised. So it's evident that we need more love and compassion to be spread around this time here on the Navajo Nation. So thank you so much. God bless you. We'll see you on Thursday at 6 p.m. on the next town hall meeting. And Nakhandah nashigi dabado no hata ye dabatzil dole aro ye hadalni dole aro biga hado dahatne I don't know what ncho ha ista hota alchiyadil tio do hota sani ya da ho ada aro hota alchiyadil tio do hota ya Kodo nihike nihinan da nihinas en galchini da nihinas hota elkije yada stila da ni dole ado shida zo hota yashti dole danzen dole dota chikad nasnegi diko de kosenskagi nast aids ata Asasi clean of the nanny clinic, the Kai jail station days national, DB Kaho, Ashikadoshina. Aro Komodo, Washington has Anigido, and the niche that the no by yet here. Juk a day, the Nia. Dean lay Sarah Zanaga office that Eggy, that del car. Dilanan Sane, don't that nesta, that ne. I say that Pinty, that del car do left that ne. She could nash ego, jo yakon nistinas nigi, Beninagi di mask chadele. Bado do hastat Tesalado, Bala and El Yadel here. The no, Nantin couldn't daily. I don't hear Lado color was Pekada, Kisada Holland and the Sot, the no, the Yadat here. A hot an hinan Shidale ego, aiding Washington on the Linshota. Aro Lana, the Nosenigi Jonal, so Snaska de Schlicht and Nosenigi, Naha Edole. Oda del Carlo Eaton. Don't the Anessa Dole, Dolana, the Nosenigi, or Naskodal net Dole. Abinina Kodo Andel now, Kodon Nakanda Neshigi Bada Huilia and the Nitota. The Bahazani Hada the Liagi became zero, do Nas, Nishidale Ego. DB called as she gave us in there. Do Adin de Kagi dog Adania. Kadan, is a Bahalondo left the hand. To Ababa Bagi a cold masks of the Chadash, Ashwanish not cleaning. Ada Hasia Kadoyo Hashkej. Yadel do band that need jo any masana chain nala naslenigi any kin and tindishni. Sakon Halchin weekend dal khal. The computer that egi da ye biga hata nod. Jo kon de behazini and dal khal. It's a yadal ki ashon shike naslini. Hadai nosna da badahna. Hadai sanal sa da badahna. Ashkejana and Tinabida Ilzati Chishkedoshuna. Eben Nai Kodoni Joba Inchkit. Had I not let the Bichadika. Ado Benhit Zil Dole. Naso net Nija. Also, Shinhit has seed Dole left in it. God bless each and every one of you. And to conclude in Navajo, I just said, support one another. And tough love goes a long way. Those of you that are listening, many of us grew up with some tough love, and some of these new generation didn't get raised like that. And you can see it by the negativity in all parts of our society. And it's time for us to take control of our household and to be open to our way of life teaching, so that our people know that we are resilient. And the way we are resilient is honoring and respecting our doctors, our nurses, our police officers, our leaders out there. Those that are on the front lines on a daily basis, taking care of each and every one of us. Pray for them. Thank them as you see them out there. They'll appreciate that. God bless you, and we'll see you Thursday. Our next speaker is Dr. Perfilia Fowler. She will give you an update on the reopening. We're looking at reopening gradually, right? Not all at once. You know, everybody's saying keep everything closed. You can't keep everything closed and get our elders the direct services that they need. I know a lot of people are saying, I can't get things done because offices are closed. You can't have it both ways, ladies and gentlemen. But if we wear our mask, if we social distance, we change our offices around a little bit, and we wash our hands, we use sanitizers in our office, you know, we can do it safely, to do it in phases. And so we are reopening August 17th of this next week, next Monday. And so we are going to have Dr. Fowler explain the reopening. It'll be on the 17th of August in gradual stages. And we do have protocols in place for our staff. If there's a situation that happens, we already have protocols in place, and that'll be shared. And if there's a spike again here on Navajo, spike off the Navajo Nation, we'll quickly close things down just so that we are safe and everybody is safe. But from Sunday to Monday, only 7 positive cases, and it's because of each and every one of you out there doing your very best in keeping this virus at bay. Thank you so much, Dr. Perfilia Fowler, ladies and gentlemen. Dr. Fowler?
Mr. President, Otto, Vice President, Chief of Staff, colleagues, employees, listeners. Shady my dishki, not Toricini, Bashichin, Ashe, ya, the Chaneldo, Tapa, and the Shiche. For this Ahodiana, Ade is a Chishike, a Kohe, non Hidish needle, let Arnold, Adeta is not Sai, Ado Hashine la, Bahe Nitzen. Do Hashine la ya Kodobe has Ani, Lini, Bikahuina, a large Bahe needs and Kodo. Ado Hashin Sogo Kodobe has Ani Kodadani executive order de Nini. A Kodo Bedeni Nation lay Wushi Dizata Ado Shte at 18 Dino Ana Ki the Mona Asli Okonzago Hashin Sogodina Nishi Nahulian le a ko Hashin Sogodi the Quas. Nahihiki at the Ize Batten, Oko Kodon Hinat Adan Lenny and Hindahalne. The Achito ni Ze Pitata is Bali Aben Dake, Joe Hashin Sogobene Bahnle. Ado di the Haslago Else no Winosen. Ado Hilla Tanda Gistalo Washbe, Joe Hashin Sogo Nantini it. Ado di Kodo o Yugoshi be. Ben hitch ben da wheelne. Hashino slashe da sla and le a conde. Joan he in it Ado an he in a haha wins and don a yo dan hini nini ben na dan hiti ne. Those says 0 a kodo ad the neck etche. Beyash kitle ad the neck etche a ya hashin so on his and lenny. Badatio badato hala jo a hut adon nantin. A conde Latoshe, Kodo Abelagona, Catch a sudden linny, Behodation, a conde, at said, Ige, a taha of sea, Don Hinago, or any Beha of Sido, Hajobena Hinotin. Niho, what the AO, you nanish, is Chet the Honodo, nanish the Hono, Ada by here Winson. Hoshete kadna tatilkas chisdan da he thotan na da he nal tloshi da basht et da tle ho wanda bakhatne ist et da tle jo e ni he ni hanan not ani ni hanani ani swisani tilke jike da ni tlini ni hin khanasla ako a de shi ni he mat ni he je ni he nale ni he che ni he masana be khati lwal Ado la yubic itchseed, and Jot Adan dan hidden Tinolan here the ho a. Hashine lae and neo tidot an hitchata at the hop begin a need netle. Ado o ata a jin the need a slaya. A ko o nachawini and a shia at Hazan Linny batistio dan hit on knee. Hashini tla edi bilaganek at your Facebook or yeah ana and lady by a delti. Eshe pigeonini the opportunity the ashi ho is ditne. Ado heshi with hajije hamahaje. Ado ho hakeya has aja pigeon. A conde. Jokodon hinat ahane. Oshim nahatsuta deals and dole. Harder the late shot the nizi. Ot anza do yat ehonan tea. ana let the concert be any or she not so that the deal see not so that the zendole jo ha she she and now ti jo aj e do bast at the need e da sto jo e na an eta na ntin ako kodo ba hadation higi e di na khandal ni shi sani tweeted ke ke ni ba hani zini ben na AD reopening plan beditne a John that on nestoya at honata and nestole. Ado not ani no flini nihi o nihi nahanas la. A jo quest twisani to cage ken hana do kato. A John not not he quahat a al empty ho behes ani lini hot ahata delia. Hot akado ben hashnet ole. Todo ashdesh ida hashine latslat na tani dan lini kodoya yinashnesh to eda ba he nesi o jedon hizada distado nihina antindon he o ilpita solani shizida ba hens ado ko dio jeda dan lini hashin tsoko tato naikias tidon haine in kodishi Yiskadoshi but the Chido le Ashintich Ado Koepahotil Nihle Oversight Committee that should need Ashi to add it all need. So at this time I'd like to thank all the listeners. We appreciate you tuning in. We appreciate all of you that have been abiding by our executive orders. As you may all know, the executive orders, all that kind of led to some special duty pay. Once this executive order is lifted, you have to understand that special duty pay is no longer going to exist. However, we do have a public health order that will remain, and those are for individuals that are working still frontline, as far as Department of Public Safety or community health representative CHR the Dunlini. They have what is called the overtime. So we do have some areas that we will be relooking at with our Office of Controller's Office. So those are some of the things that we'll be looking at. As far as the reopening plan, we do have a plan, and then also what is called our worksite safety guidelines. So at this time, I'm going to share a document. It's our reopening plan. And with that reopening plan, there's the reopening plan I'd like to share is, and it's going to be available online. It has the reopening plan for Navajo Nation. It gives a brief description. Is it intended to guide our reopening private and public sectors of the Navajo Nation in a safe and organized manner in age of COVID-19? The plan will be in effect for the duration of the COVID-19 pandemic. And we have a plan that provides guidelines. I'm not going to go through every line here. We are abiding and working closely with our Health Command Center. So any of these timelines, the guidelines, we are continuing best practices to prevent the spread of COVID-19. It talks to us about our social physical distancing, wearing a mask, and on down the line, avoiding contact, avoiding touching your face, nose, all this. So I'm not there's so much to go over. And then with that, we also have policies and procedures that prevent the spread of COVID-19. Places and businesses ensure that physical distance between personal customers and any member of the public, so if you go over this, and this one's an 8-page document, our reopening plan, and we want our programs to implement engineering control where they are appropriate. We are telling our managers to increase the building ventilation. We are implementing some of the flexibility work schedule. We do have some employees that are currently on the staggered schedule. We do have flexible leave policies. We have there's another policy that we also have, the staggered work schedule. We also have the COVID leave. So all those are references various areas in our plan. We are continuously monitoring the reopening, and will be following the status schedule. If we look at the status schedule, it's a gating criteria for reopening. And it says the cases, the tests, and the hospitals. In addition to the gating criteria with our Health Command Center, we'll also consider the following. The cases that are coming in, ating dapat kahita akon nihinatani yahod na hashin do at anit beta tahwil na da kahi da hutam da kahi yisapansala. We do have the status schedule. We have the red code, which is high restriction, the orange code as moderate high restriction, the yellow code as a moderate restriction, and then the green code as low restriction. And if you look at some of these reopening schedule, look at the red is the grocery stores. What did I say the red was? Which is high restriction. 10 person or less in the stores, gas stations, laundromat, Department of the Net Education, AJ Hashin Naz Anodo Nahas Ango Asati, Ajashin Kodosa Yen Kisna. And then we also have available resources and then the glossaries of all the areas within the reopening plan. So this is a brief run through of the reopening and will be available through our Health Command website. And the lengthy portion of this one is our worksite safety guidelines. And it starts off with the glossary, all the information, the COVID leave that I explained, the hours worked, and so forth. Reoccupancy procedure guidelines, special duty pay, telecommuting agreement, the AATF. And it goes into the workplace, the Navajo Nation Executive Branch Worksite Safety Guidelines are intended to guide the Navajo Nation Executive Branch Division in having employees return worksite safely during the COVID-19 pandemic. These guidelines are not specific reoccupancy procedure or guidelines, but should inform development of each division's reoccupancy procedure and guidelines. Divisions are to use discretion in deciding the extent to which they implement these guidelines into their reoccupancy procedure and guidelines, and may adopt measures in their procedures and guidelines that go beyond these guidelines. However, reoccupancy procedures and guidelines must always be in conformance with the Navajo Nation Personnel Policy Manual. These guidelines shall be in effect for the duration of the COVID-19 pandemic or until further notice of the administration otherwise, and may be amended from time to time. At this time, I'd like to let you all know that each division has a reoccupancy reentry plan. So this one, pretty much the guidelines of safety is a universal to where it provides guidance, it provides measures to where making sure that we are bringing our people back safely. So these guidelines and going on down the line, it protects our co-workers, protecting ourselves, our co-workers, we will protect our family members and friends. And it goes on forward. And this one's about, I believe it was about 18 pages, reoccupancy procedures. And again, this document will be made available through online to where you can fully take a look at it when you have time. And if you have any questions, feel free to, we'll provide my email. And then if you have any questions, feel free to call me and we can answer any questions that we may not have answers to on this document. It goes more in depth of a social distancing guideline, custodial services, alternate work schedules, the special duty pay, and it goes on to the preparation. And then the employee, let's say we have an employee that is showing COVID-19 symptoms. You immediately report to your supervisor. There are steps, there are protocols. the contact tracing, investigation, decisions in regarding return to work once you're diagnosed, ado sa nakata ita dan lini dan nakaatkahan na ida saton hiche os kata beton no so sato ben hikato yen hikata do the west. And there is a questionnaire, and for our program managers that the following questionnaire will assist them also. For example, let's go to alternative work schedule. Look at the first one. Do your procedures and guidelines provide the employees may be able to telecommute? Jadi na tani no sini ni hina khasala. Hashin saba ashin ni sabat enta huit and Asia kwa bez ani bakhat tahigish be bezbahzen bezish be beztahosnet. So if there's any questions on some of these where our office and our Department of Personnel Management will continue to guide, do we have like PPEs enough? As the employer, we are to provide the PPEs, and it also talks about the vulnerable personnel, the PPE portion. Have you ordered any PPEs? So this would be a question to me as a division director. For our division, yes, they're ordered. Some we have distributed. So as an employer, I want to just clean or just disinfect the just for the in the workplace. Recommended deadlines for completion. We've also included that in the safety guidelines. So by July 27th, at August, that's at the whole your class. It's at the whole your class or in that initial. I don't that initiate PPE will yeni at la holland or less at la bend the initial less. Jo AD quite a deadline see by the holland or sato bed or was lido jo the next we saw Nina Chito be Isha Alzani. It's to make them aware of all available resources that is available. A cohen so a quado ben situation at do ado Yananat eto ehet nikidini do le hashin so ani quado bikamonos eniki. And I'm sorry I went through the slides pretty quick with the short amount of time I have. Like I stated, it'll be available online, and I can provide our information as well. Na ikihet anotson kodo put on hisuntahan nihish kodo put sato na nishut ish idolen edon sangot sato bikati ka ako. Na ikihet. I want to appreciate all the listeners for giving us this time. And at this time, I believe our next presenter is Dr. Yellowman. Again, thank you and have a safe week. Dr. Yellowman?
Good afternoon. I want to make sure that you can hear and see me as well. Adoyat Ada Hiha Shay Miss Yellowman, Pearl Yellowman, and Shea Ado Tsana Bithlin Schlendog, Dizafana Bashichin, Trobahanda Shiche, Ado Honala Nate Chanela. So I want to say thank you and make sure that we are good and up on rolling on our screen, and you can see information here that I'm about to share. So I work through the Division of Community Development, and I have some information to share. One is we have been discussing with IHS, Division of Community Development, NTUA universities throughout Arizona, New Mexico, and surrounding areas on discussing the Navajo Nation COVID-19 water access mission. And on the screen here, you can see several of the water access points. The temporary watering access points are those points that have been identified for construction or improvement. The permanent watering points also exist. Those are additional watering points, but the temporary are the ones that have been identified. So I want to make sure that you can see this and that I'm sharing it correctly. Let me see. Let me reboot it here again. Okay, how about now? And if that's not the case, then that's fine. What I also want to share is that the Division of Community Development has also been working with CORE. As you know, CORE is a nonprofit organization. We've been trying to assist in providing and building individual isolation units. And right now, currently, CORE is hiring. We're hiring individuals to continue building and constructing the individual isolation units. Some of those isolation units are for individuals, and they're roughly about 8 by 12 feet. They help individuals heal and self-isolate and self-quarantine anywhere on their property or land. So that's something to look out for. We're needing assistance, and that's where we're asking for people to inquire if they're looking for temporary work. I also want to share that we're working with the 110 chapters on the reopening. The reopening, as Dr. Fowler mentioned, the Navajo Nation has created the reopening guidelines. This is applicable to the chapter as well. The Division of Community Development, along with DOJ and ASC, have been providing presentations on those reopening plans this week. We're still set to reopen on the 17th of August, and everyone has been working hard on decreasing those numbers. So we're thankful. We're thankful for leadership. We're thankful for our first responders and our health facilities in assisting us. And everyone pulled together. Everyone pulled together, worked together. Families looked out for each other. Communities looked out for each other. And our numbers have been consistently going down. So our return to the chapter, return to operation plan, our guidelines. There's guidelines in there that consist of communications. Our communication has changed due to COVID. We utilize technology a little bit more. We utilize conference calling. We utilize social media such as this platform here. So there are some guidelines to help keep communication at the chapter level community based and open and transparent, so that you are still aware of what local governance is working on and working towards, and that's what we want to promote. The guidelines are also applied to chapter employees and officials. So we're making sure that the base and the core of the guidelines is safety. How do we maintain operations and continue to be safe in providing services to the Navajo people? And that's what we've been. That's what our goal is. That's what we've been challenged to do so. So making sure that we are continuing and providing those services while adhering to the CDC guidelines and the HCOC guidelines. So that is what the chapter guidelines are. I also want to share that and through the administration, through the leadership of President Nez and Vice President Leiser, we've been working diligently on trying to address all of the projects and the project listings that are within the responsibility of DCD. So we also have been maintaining those projects with the respective agencies and maintaining our communication with those agencies, with the 5 agencies, and updating on all of our projects as well. So we want to continue that communication at the chapters with the chapter staff as well. So we want to continue working on that. We're also providing some technical assistance on assisting each of the chapters for expanding their capability of providing presentations, Wi-Fi, and information on their website. We want the Navajo people to know that information is available, and we're trying to help and assist the chapters in getting the information onto a designated website. There's still information that needs to get out to the community members, such as scholarship information, housing information, land information, all of this information. If chapters are needing and seeking assistance to put that information onto a website, ASC and the IT through DCD have been assisting or available to assist those chapters. So we encourage that form of communication as well, and making sure that that information is available to the chapters. So I'll keep my presentation brief, but we are looking forward to reopening. We're looking forward to maintaining safety and adhering to the CDC guidelines. We appreciate leadership. We appreciate President Nez, Vice President Leiser for the leadership. We also appreciate all of our first responders, our police officers, and our medical staff for working together and decreasing our numbers. I feel and I see that we've become very disciplined. I feel very safe here, and I feel very safe on the Navajo Nation. And I appreciate and value all of those out in the community who wear a mask, who wear their gloves, or who take necessary precautions in keeping each other safe. And that's the type of community we want to continue to foster as a safe community. So I will conclude there. I also thank Dr. Fowler for her presentation. Also, next on the conference call here is Dr. Jim that I will be calling on. So my colleague, Dr. Jim from the Division of Health. So I thank Dr. Jim for being on the call. So Dr. Jim, if you're available, I'll be passing the baton on to you. Thank you.
Thank you, Dr. Yellowman, for those comments. I just wanted to thank all the listeners here that are on the call this afternoon. I just want to let everyone know that we are still slowly seeing good numbers regarding COVID in the last couple of weeks. So I just want to introduce myself first. Donna Ensley, look on Son Tachini Basishindo, the Saint Dasachedo, Lazafone Dasanella, Adohat I Stansna, and I'm the Executive Director for the Navajo Department of Health. I just wanted to thank President Nez and also Dr. Fowler and leadership to address the COVID-19 today. The workplace safety guidelines for the tribal programs is very important. It's not only a message to the programs for the tribe, but also it can be replicated for use by other entities as it follows CDC guidelines. So as we're preparing for staff to work in a safe environment with COVID-19, it's very important to continue to follow proper safety guidelines. So some of the things that we're continuing to monitor here at the command center is the lifting of the restrictions of curfew hours. The daily curfew hours are from 9 p.m. to 5 a.m. in the morning. Also, the 32-hour curfew is starting 9 p.m. on Saturdays and ending on Monday morning at 5 a.m. So there should be limited movement on Sundays. I didn't drive around to the command center to do anything on Sunday, so I didn't really see if there are people still driving around, but I hope that people are still in compliance of the curfew that we have for the public health order. On Saturdays, we obviously have hours that are still open for COVID-19. And I just want to recognize that there are some movement now on the reservation regarding getting access to services. So I just want to appreciate everyone's patience, but we are now beginning to monitor these smaller restrictions that are being lifted, because that's part of public health surveillance, is to understand the impact of these community mitigation strategies. Since there is no vaccine or there is no cure for it, the best we can do is still use some tools that we have regarding movement and mobility on the Navajo Nation. And that means that we have to carefully assess these factors that we put in place, such as the lifting of these curfew hours. So I also tend to see people that are more active as well, these curfew hours. So just want to thank everyone for keeping in mind for staying healthy and whatnot as well during the pandemic. But under the Health Command Center, just want to recognize that that we will be also lifting some certain movement again, which is employees returning to work for tribal programs, possibly for other businesses, while other businesses will be also opening. But we're going to have to keep those numbers down as much as possible, because the gating measures I'm going to broadly talk about here that the epidemiology uses is that the gating measures are basically adopted from the White House and CDC, Centers for Disease Control and Prevention. There are three areas that we really look at: basically the decrease in cases with no sustained, no sustained rebound, meaning that the numbers will continually increase. So those are the stuff that we look at, as far as also the positivity rate for communities, meaning the number of positive cases across the Navajo Nation. And it really doesn't relate to the number of what we hear sometimes. Let's just put it this way, that there are more testing that are being done, and the more testing that are being done, we're seeing more positive cases. That's not really the truth about that. You can do more testing and you can get more negative cases, which is a good sign, and that's what we want. So that's what we look at and monitor. We also look at hospital capacity, making sure that we're not dealing with a surge as well, that all hospital beds are available, including inpatient and also ICU beds. And so those are looking really well at this point. So we are monitoring those. But the impact of these curfew restrictions, we really won't see after till maybe 5 days from the date it happened. So we'll closely be monitoring those, as we know that as long as everyone continues to practice safe hand washing, social distancing, wearing your face mask, and also being able to keep on top of your hand washing. Those are all factors of using those community, what we call prevention strategies, but mitigation strategies. We're really looking at social distancing here. And this factor, like we're lifting the lockdown to a certain curfew hours, only a lockdown for a shorter time period. So that's my report on where we're at with the command center and the surveillance of the daily data that we have. Usually I talk about some preventive measures as handling cash during the out there when you're running your errands, making sure you wash your hand before you handle cash, do contactless payments also as much as possible. When you're at the laundry, have hand sanitizers, clean down the laundry, wash your clothes in the warmest cycle possible. Other factors we look at is gassing up when you're gassing up for your vehicle, making sure that you clean your hands after you use the gas pump or after you touch the touchpad on your gas as well. When you're closing or putting the gas pump back on as well. So those are just some preventive factors that I always go over and encourage everyone to look at. Also, messages around traveling off the reservation. Is it necessary? And also, meaning that are you willing to put yourself and others at risk, those that have underlying health conditions that are home or will be traveling with you, making sure that it's a really a valid or a necessary trip that you can have. There are people that still commute everywhere else, but making sure that you are practicing all of those preventive measures when you're out and about is very important. We can live with COVID-19 if we prevent and do all these safety measures that we have. Other things that we should be considering all the time is also limit social gathering of any sort. Doesn't mean that we lifted the curfews and whatnot. Doesn't mean we're permitting social gatherings. So I just want to let everyone know that limit your social gathering at any time. Only should be gathering with individuals in your household, immediate family members. If you don't live with immediate family members and your social gathering, that's not that is going to put everyone else at risk because you don't know what people are doing on their own time when they're visiting you. Everyone should wear a mask indoors if they are even visiting you. If the person is not from your household, make sure they wear a mask. If you're gonna do any kind of delivery from food from them, make sure you wipe them down and also accept food at that point. But otherwise, there should be limit. Any kind of gatherings for any purpose, I think, can be withheld at this point of gatherings. There is also some items that I usually cover, such as saying no to visitors. Also, that can offend people, but it also can save, especially an elder or someone with health conditions. So even though if it's your only family member that wants to come and visit your grandmother or your mother or your auntie, and you're worried about and you're the caretaker, you have every right, I think I would say, to refrain them from visiting in person all the time because you don't know what individuals are bringing to the household. So you can make signs, you can have them conversate by phone, you can have them drop off food and make sure they wear a mask. And so there's many ways that you can continue to prevent and live with COVID-19. You can have them talk outside from a distance apart, 6 feet away if they really need to talk, but not indoors. So there's ways that you can continue to provide those kinds of preventive measures. As I'm talking to you, my mask keeps falling off. So I don't think I tied hard enough. So make sure all the time that you have your nose and mouth covered, and I didn't tie it hard enough. So excuse me for that. So those are just some preventive measures. I just want to remind everyone. So as we're going into the week, stay safe, everyone. Your actions are actually will save lives and keep everyone safe. So it's all up to us. So it's all so I'll just speak a little bit in Navajo. Just wanted to thank everyone. Non non Jill Jimin Jigato Kaadi, it's East Bahayan Jabik Edin Ido Kaadi, non Hidini do non Kahawanda Anai so Tanigi di the question Chagi, not say that Ati Kaedi nas niki ati akon halon de kaedi yahon nis it's iso yahon nis to ayun hitaneto bedint indande kaedi aklichen kaedi anhedanit elshindeya di kaedi eneledi kaedi hin chiton hinze betadinas balo do kaedi aklichen hilakanda keso do Adodi aja and ke go shinte ya di ko edi de kosinchagi nas eta to novo to nita hot aban sis kes shikata sazendi ko edi at ispa hayane ko edi big edinch ingi ko edi he non kiti ni do himasando ko and hiche do ko edi hedan himayazo do He asked that Lani Kwati issues the Kandabent or the head or the photo Nazi he cancer the Yeni do the heart disease or that any didn't ingo a Kwati but has ongo Kwati job at the has yado attended on Lani do other the Kwati about the has yango a Kwati wanda ben na has trato kwaeti iando he ita de kwaeti panto hasni hota da big da no he go ash hode de hot ade ya to kosin chagi nas eta pede dos nata do di kwaeti in na definitely quishi de na I think it's on in na has ke kwaeti de kosin chagi nas eta da but ade do di kwaeti he chedon himasane kwaeti has ata tondo with benda hegi kwaeti ge go bedinst in na additional other kwaeti a kwaeti but the hyang go shinte bansis case additional do the kwaeti the curfew sa yani do ala that any on a deck at is a big hande ashi what end up on sita case kwaeti on a kegodeya do the kaati summer hadiani ati hos todo la epana albehegi akwijenshi kaati at the ela epan bestanda condition aya at eto ati shin sa ating danos kado kaati hawan da at oda ila da as kado da shin panda kaot what ashin in masandon hitesana ati shin what hawan the best nice so twango shinte ya although yeah non kidini do no a day yeah so thank you very much for listening and I just wanted to thank everyone for being on the call and the next person on this call I just want to introduce Miss Patricia Ghani with Department of the Net Education. Thank you very much.
Thank you very much, everyone. Am I on online?
Yeah, we can hear you, Ms. Connie.
Thank you so very much, Eli, for that. Again, as introduced, my name is Pat Ghani. I'm the acting superintendent with Department of Dene Education. Thank you for those on the call here. And members of the audience, I appreciate your presence here to get updates on DODE's activities in relation to reopening for next week. As we all know, we have currently in place an executive order for closure of government through Sunday, August 16th. Part of that closure, it involves our schools here on Navajo Nation. We do have a number of schools that have reopened through virtual learning format since the early part of August, and those schools have been in operation since. And our interest is to be able to support those schools reopening to offer services to the students in the safest way. And for that reason, those schools are allowed to operate in a virtual manner. Now, next week, we also are looking to other sectors of Navajo Nation government continuing to lessen its restrictions and to move along the continuum of reopening those business sectors. And at this time, I just want to provide clarity that our schools remain closed even after Monday of next week. Mr. President Nez and I share the same agreement and sentiment that we want to assure safety for our students, the teaching staffs of our schools across the nation, and to keep the communities as safe as possible. And we believe that the way to do that is to support online learning for our students. Having said that, there are some measures that Department of Dene Education has been involved in on various fronts with various entities to strengthen internet connectivity for our students and teachers, all in efforts to make online learning happen with ease for our schools. And in other areas of school reopening, we also wanted to share out that Navajo Nation Board of Education members passed a resolution last Thursday in its convened regular board meeting, a resolution approved to support online learning for our students related to all schools on Navajo as well. That information is being disseminated to the schools across Navajo just as quick as possible so that our leaders are informed of the stance of Navajo Nation Board of Education with the support of Office of the President for our online learning. In previous meetings, I have also mentioned a poll that was done of our school leaders and our parents as well. And this was ahead of any positions and recommendations being made for online learning. And the parent poll results that came back indicated that a great number of our parents really sided with a recommendation for distance learning. And this comes with their concern and fears of safety measures and for the safety of their children as we embark on the fall semester of school. And that information was shared with various stakeholders. I indicated that DODE, the Dene Department of Education, continues to formulate ways that we can be of technical assistance to our schools as we navigate school reopening amid the pandemic. What we will begin to see in the next few weeks is some professional development opportunities with our school leaders to support them on variations of hybrid learning, to move toward, when the time allows, a face-to-face return to the classroom. And that may not be quick, that may not happen this school year, but certainly that should always be the goal that any of our schools have in mind as we return to what we deem to be of normalcy for our students when that time allows, as I indicated. Now, a couple of other dates that I want to provide some updates on. We have knowledge that our BIE operated schools, which we have 32 of those schools here on Navajo Nation, do have plans to reopen in a face-to-face format come September 16th, 2020. We are continuing to have some dialogue with our colleagues from the BIEs and to further define and to reach an understanding as to maintaining safety for our Navajo students and teachers here on Navajo Nation. And as Dr. Jill Jim has finished sharing right before my presentation, while we do see a consistent decline in the number of our people testing positive for COVID-19, we should be very vigilant in understanding that we are not yet quite out of the woods. And for that reason, we need to maintain that vigilance of continuing to practice social distancing and all of the other health safety protocols. And that is one front that we are trying to share with all of our other colleagues from BIE. Furthermore, we also continue conversations with our adjacent states of Utah and New Mexico, to honor tribal sovereignty with the state's Department of Education, including Arizona Department of Education, so that if we have to continue on with closures of our school doors, we need to be able to have their understanding and support for our students to continue in an online educational format. And so those conversations continue to that end, and our Dene Department of Education work group continues the work on pulling together a set of gating criteria, which will be released pretty soon here to our schools here on Navajo Nation. So we have started the school year. Some schools have not yet started, but we envision that they will do so virtually. And so to have that goal in returning to a classroom setting, we have a phased approach in our gating criteria, and which spells out the conditions that must be met in order for schools to consider moving on to the next phase. And so the first couple of phases, as we see in the document that we are crafting, speaks to online learning, and finally moving along to a hybrid situation. And hybrid meaning that there is a combination of face-to-face instruction happening and an online learning part of the time as well. And that time will come when those gating criteria are completely met. And part of that includes a very low risk of spread in the communities across Navajo Nation. And as was shared by Dr. Jill Jim as well, one of the prongs in that is we have to have at least an 80% or less of bed occupancy in an IC unit across Navajo Nation in order for us to be deemed to have met the gating criteria to move along the continuum. So as you can see, folks, that we've got quite a ways to go. And Dene Department of Education will continue to advocate on behalf of the students and teachers and the communities for practicing safety and by way of supporting online learning for our students. Now, I did indicate that we do have a glaring challenge of the digital divide here on Navajo Nation, and we will also continue to work with all other relevant entities here on Navajo Nation to impact change so that we can increase internet connectivity for our students and staff members as they telecommute. And I just want to reiterate that the reopening of government, which is slated for next week, actually is related to reopening of business sectors. Our schools do remain closed with the option of schools operating through a virtual format of learning for our students. And so I just want to be able to share this in Navajo just very succinctly for the benefit of those who might have a dominance for understanding in Navajo. Yat eto ke shikesha de ne kwa gishanaho aigi ke nkidishni dole she yadi Pat Ghani in the the Department of Education ya acting superintendent ni go aja shananish isha ko kwa yadi ultra not lehegi go baba johdi alchadot ni digi epic ehogo kwa nikilch ohonish ahdole di ultra not lehegi Han Sogoshiben Dailish, the Net Department of Education do Sani do has twee program managers dan linigi equi but nelgo. Equi D phased approach yitnigo ke wana ango ta'an do niligi ajahan Sogoshiben danish. Dr. Jill Jim, AD Navajo Department of Health Services, Ajitaho ishto ajahut in the CDC Center for Disease Control yishne and dadnashigi at end the gating criteria yishnigi ultra ke ago an dodni judi ek ad kwadod chinahada east the schools go ultra Navajo Nation baka called education ultra Arizona Public School, New Mexico Public School, do BIE operated schools, do private school, do tribally controlled school. Ego ultra big the need in the Net Department of Education do. BIE operated schools September 16th go on ni go ye den hodet a face-to-face classroom President Nez do nadlishin linigi BIE da the higi be nahot hajoban sa kes do di ilchina ol trajan be do ne donal nishi yahan do datligi hajoba ashlahodit do di higi yisit an etzago und da hot abo honet zanti ni go aje hot ego nichin nahat igi di tzagot a code ado di koje ultra hada istra igi online yisne aje hot ego ultra ba alia sto a call school reopening plan nishnigi di dodi from tribally controlled schools then a ko yanal nishnid linigi ajigi ya beat the need in plan reviews yishnigi on this week do she di ultra gobage in dal net do less a call not art and that ajo Sahas Kesgo, Sahoshin Adat, da Odzi do Anst e Hateliaigi, Ajigi, hot ego be Danahan Nebini ye, not so sneed ego e be at Danahodenid, and this week, a cohort ago e yabenadinish plan reviews this week. Adonana nas ya esto di gating criteria dishno bayashti igi esto aja hadelne a kodi khanza goshi khot ego nehil khaz Yasinalni ya at Zago. Ilchine quite old Tagia and do Katoba old Tai Hotaya na Kaigo na old Kato lefik in Nahadol Jishigi, Argent Benahatahigi, Benel Nishisto. A call Han Sogoshina Nishalodo, Ochot Ego ya Hugo entities yilninigi that hoshte bedi nido ado hot abe hisna hullan hinna hat an ligo eko ado yat every week isto kon za nahal jish ya ultra yadahnaz dahigi school principal yilninigi isto bas isla neidle di isnin ado big ja ya bas isla na neidle to hot ego ta nahulne Ado abahon yajigo alto khannet deils digin le khatta hos do khahod so da ol tabige desti don le yo thoda do Utah State ade art and khannet dane dehigi khotebe not ani dan linigi be ilchane nail igot ben nachet han so she night the kid ado ben nachet to na han so Nahat Anand Linigi, Beniya Hat and Beniya Hot our weekly meetings in Nail Store. A call a con Togoshi ya Nikilchohona Adole, the Navajo Nation Board of Education, Yisninigi Thursday, Yada Yah EJ or Yanel, Nal Tosbe Danahodit Ahi Ajabiji Ka Yila. AAD ultra again na be hoben nahas so ultra igi online learning o hot ego ya alchino ultra do ni go ya sad ye edan hodet nal tos nas na da nes de do sto a cot adot a hol just na idish kidnosen ya nle Besh Arbin Takesi Beach website Yilninigi Department of the Education the Besh Behene das so Ado email Yilninigi Ilto Jahallo. We encourage any input or any questions that come from the public. Your ideas and suggestions are thoroughly considered for the benefit and safety of our students, staff members, and also community members.